Today is August 27th, 2015. We're here with Amy. She's come a long way. She lives and works on the island of Dominica in the Caribbean, where she works for an offshore medical school. A year ago, this is August 2015, in August 2014, she was bitten by a mosquito and then had sudden onset of a horrible disease called
Chikungunya.
Chikungunya. And chikungunya causes arthralgias, arthritis, rashes, pain, nausea, fever, general inflammation. What did I miss?
Myalgias.
And myalgias, muscle pains.
Yes.
You've been miserable for a year, correct?
Correct.
Miserable. And no one's been able to help or treat you, is that correct?
Correct.
And your father sent you here to us?
Yes.
Okay. So tell us very briefly what it's been like for you in the past year. You also told me you've been on steroids, correct?
Correct.
Lots of prednisone.
Lots of prednisone.
And you just got off a few weeks ago, correct?
Correct.
All right. Tell us what life has been like for you.
It's been pretty debilitating. It's been very challenging. I live a simple life. I walk to work. It's difficult to walk to work. When it used to take me 7 minutes to get to work, now it takes me 15 minutes. It's difficult to get out of bed in the morning. My arms are so weak sometimes that I can't turn the shower on. I can't get groceries from the store anymore.
Oh my God, you can't turn the shower on sometimes because of pain and weakness.
Yeah.
Can't get groceries.
Yeah.
You've also gained 20 pounds.
Right.
The viewer can see your body morphology. I know that you're sensitive to that, but I also want the viewer to know that on the steroids, you gained 20 pounds, and that was beyond your control.
Right.
The food you're eating is in your control, and we discussed that.
Yes.
Okay. I'd like to see you get up and walk to the door, please.
Sure. So now I feel like okay because I've worked out a lot of the kinks, but in the morning I am very, very stiff. It's very difficult to move. I usually am contracted a little bit.
So you're more fluid now because it's not morning. In the morning, it's really tough is what you're saying.
Very tough in the morning.
And I also noticed when I asked you to get up out of the chair, this was the second time. The first time, it was much more difficult to get up. So once you're moving, you seem more fluid. Is that correct?
Right, yes.
All right, let's see you get down in the chair, please. Are you able to get up and down without your arms?
Yes, but it's challenging.
Try. Okay, good. Thank you very much.
Yes.
And you've given me permission to video you and post you on YouTube. Is that correct?
Yes.
Okay, thank you. Amy, aside from your primary problem, which is chikungunya virus, you also have a problem in your left knee.
Yes.
And straighten both of them, please, for the viewer. Okay. You had an injury to your left knee how long ago?
2006.
And what was the nature of the injury?
I tore my ACL and meniscus.
You tore your anterior cruciate ligament, which is a key ligament, and a meniscus. And they did a surgical repair, and you're probably worse off than you were before, or as bad.
Yeah.
Okay. As bad. Okay.
As bad, yes.
The joint is arthritic, and you have chronic pain in it, correct?
Yes, correct.
Okay. Did the virus make it worse?
Yes, I think so.
But you were having trouble in that joint regardless,
right? Regardless, correct.
Okay. Well, we're going to try simple ozone on you and see how it does. And if that doesn't work, then we can try a more advanced procedure. Is that okay?
Yes.
Good. Amy, aside from your primary problem, which is chikungunya virus, you also have a problem in your left knee.
Yes.
And straighten both of them, please, for the viewer. Okay. You had an injury to your left knee how long ago?
2006.
And what was the nature of the injury?
I tore my ACL and meniscus.
You tore your anterior cruciate ligament, which is a key ligament, and a meniscus. And they did a surgical repair, and you're probably worse off than you were before, or as bad.
Yeah.
Okay. As bad. Okay.
As bad, yes.
The joint is arthritic, and you have chronic pain in it, correct?
Yes, correct.
Okay. Did the virus make it worse?
Yes, I think so.
But you were having trouble in that joint regardless.
Right, regardless, correct.
Okay. Well, we're going to try simple ozone on you and see how it does. And if that doesn't work, then we can try a more advanced procedure. Is that okay?
Yes.
Good. Well, we just did your knee, and we know you have a significant injury in your knee. And when I examine your knee, there's an effusion, meaning there's fluid and inflammation in your knee. Mm-hmm. But we just did ozone on it, and how does it feel?
It feels good. It feels like it feels less creaky, like smooth, like the joint moves smoother.
Right, and you were able to walk to the door much easier, is that correct?
Yes,
Let's
much
see
easier.
you do that. That seems to be much more fluid.
Much more fluid.
So we'll see how that's doing the next time.
Yeah.
So now we're going to do your high-dose ozone therapy.
All right.
Today's date is September 8th, 2015. We're back with me,
Amy.
And she's going to be leaving, and she's got the Chikungunya virus. I always get that wrong. She's had 3 high-dose ozones and a couple ultraviolet treatments. And on a scale of 10, if you came in here in 10 points of misery, how are you doing now?
Good. I'm feeling much better. Probably about a 3 to 4.
3 to 4. Okay.
Yeah.
And you said your muscles are coming around. They're sore, but they're coming around, like
Yes.
they haven't been used, correct?
Oh yes, they're very sore, but they're waking up a little bit, so it's good.
And
that's my biggest complaint right now is just soreness. So.
Okay. And you weren't able to use your muscles before, correct?
No, the pain was just my joint pain was really terrible.
Right. And the joint pain now?
Hardly any.
Hardly any.
Yes.
All right. All right. So what I'm hoping is that the virus has been purged. We'll find out. And you will get some lab tests to confirm viral titers when you go back, correct?
Sure, yes, I can.
And you'll send them to me, and you'll give me further reports, correct?
Yes.
But you were at a medical school, for the viewer, you were at a medical school, and you were sick with this thing for a year and miserable. And in just a couple sessions with us, you're dramatically better and all the joint pain is gone, correct?
Correct.
All right.
Yes.
I may post this?
You may post this.
Thank you, and I hope you're pleased.
Yes, very pleased.
Okay. It's a very bad virus, and I understand it's quite endemic in your area.
Yes, very bad virus, very endemic.
Thanks.